Good day, residents of Saba. This is Island Governor Jonathan Johnson. Today I'm accompanied by Dr. Kuhn, our public health doctor, Dr. Blauboer, our head of the hospital, and Nurse Lizette. We are here today to give you information about COVID-19. As we are all aware, since earlier this week, COVID-19 has become a worldwide pandemic. We would like to inform you, the public of Saba, what effects that has on our island. As we all can imagine, we are all scared and we all are wondering what is going to happen. And today we are gathered to provide you with the information that you will need to make conscious decisions. That's why our public health doctor and our doctors from the hospital and our head nurse is here to provide the information. Many countries are taking strict measures, and we on Saba are also taking measures, and we have met as an emergency operation team and also the outbreak management team. What that entails is that we come together and we decide what actions should be taken on Saba. Other islands have implemented restrictions in an effort to limit the possibility of COVID-19 spreading in our area, but the reality is it is in our area, and more information will be provided on that. On Saba, we do not have any cases, so there are no cases of COVID-19, and therefore certain measures do not need to be in place now, but we do make plans and are making plans, should it happen, what measures will be implemented. There are currently the borders stricter checks. There are a number of posters and such hanging up, and we also ask if you have traveled to certain countries and if you are sick, what should happen. Education to our public, so that is something that the doctors and the head nurse will speak about, but practice good hygiene, wash your hands, and if you do have cold-like symptoms, what you should do. Many questions have been coming from the community, and I will now pass it over to Dr. Kuhn, who will be providing more information.
Thank you, Governor. Indeed, the spread of this virus seems to be going much faster in the last few weeks, and that's got us all worried. Again, the coronavirus, a new virus, that means a lot of people can get sick if it's on the island. Most people, more than 80%, will only have mild symptoms, but we want to keep it away because it can lead to more severe disease in the elderly and people with existing health conditions. The virus is transmitted from the virus that's in the lungs, and if you cough or sneeze, droplets with the virus come out. If you're near someone, you can breathe it in directly, but if you touch a surface that the droplets land on, that can also infect you. If it's in your hand, it's not a problem yet. The moment you touch your eyes, your nose or your mouth, that's when you can get infected. There's still quite some unknowns about this virus, so we will keep updating you about how long it stays alive, how far it can travel, how it does in warmer climates. At the moment we don't know yet. Most important is that we contain this virus when we get an introduction. If someone comes in from an area with a lot of corona, we will inform them, we will educate them what to do when they get sick, and we educate them on very strict hygiene. If it's a very high risk person, we will quarantine them. If that person gets sick, we will isolate them, take samples, and find out who that person has been in contact with, and that could have possibly been infected as well. We monitor those people and we quarantine the high risk contacts. And this can be a very effective way of containing the virus on Saba and keep it very small. We have the Kamar, the immigration, helping us. All healthcare staff is trained to ask for travel history. And that way we can find that first person really quickly. So that's what we have to do, and we have to be realistic that we may get people to the island with coronavirus. It's a global world, people travel, so we need to be prepared. What can we all do to protect yourself, but also to protect our community here on Saba? For now, especially important for those who are traveling, but let's all get in the habit already that we practice extremely good hygiene. That means hand hygiene. Wash your hands with water and soap, 20 seconds, all over, or use hand sanitizer if there's no water nearby. Gloves in that sense do not necessarily help much. If the virus is on your glove and you still touch your face, you can still get the virus. That's why hand washing, hand washing, hand washing. Second, don't touch your face. Cough and sneeze in your elbow. Keep a distance from sick people. And if you do develop symptoms and you've been traveling, please isolate yourself, call the hospital and wait for further instructions. In general, it's always good, even if you've not traveled, if you have flu-like symptoms, stay away from other people. The regular flu is still going around. If we can protect people from that too, that would help. If we do this all very strictly, we have a very good chance of containing this virus. But it depends on all of us.
Thank you, Dr. Koen, and now I'll give the word to Dr. Blauboer from the hospital and Nurse Lisette from the Home for the Aged.
Thank you, Governor, and thank you, Dr. Koen. Like was mentioned already before, important to know, there's currently no cases of the virus, no suspected cases of the virus on island, on Saba. However, for the medical center, of course, we need to be prepared. So we have a contingency plan in case the virus does come to the island, and we have made all the necessary preparations. That means we have secured all necessary stock. We have looked into staffing, and we also looked at how we can best make use of our facility in case the virus comes to our island. Apart from that, as of yesterday, also as a preparation measure, we decided to practice social consciousness, which means to say we no longer will shake your hand when you come to our facility. We will not bump fists, and we will emphasize more on hand hygiene and hygiene in general, which of course we always work with, but we will now also emphasize that to you as our visitor.
Okay. And of course for our more vulnerable patients, so that's our clients in the elderly home, but also our home health patients that are in their own home, we want to encourage everyone that's visiting them to also start practicing hand hygiene. So disinfect your hands, cough and sneeze in your elbow or in a disposable tissue, wash your hands before and after interactions with the vulnerable patients, and do not visit if you have flu-like symptoms. If the virus should arrive on the island, we will not allow visitors to the elderly home, and we will also stop all of the life programs.
Thank you, Nurse Lisette and Dr. Blauboer, and also to Dr. Koen. Thank you for all the information you have provided. As we all know, there is a lot of information available regarding COVID-19. Many persons, they cite Facebook and other forms of media to find information. But at the end of the day, we are responsible for providing the information from our island and what plans we have for our island. So please follow us and what information we provide, and we will be more forthcoming with that in the coming days. We have been providing on our Facebook page. I have also been providing on WhatsApp. At the end of the day, we have to rely on reliable information. We also look towards the World Health Organization, the Pan-American Health Organization, and of course, here today our public health doctor and our local health officials and the Government Information Service. So with that, I thank you, and more information will become available. Thank you.